Hi, I'm Dr. Turri. I'm a board-certified doctor of audiology with offices in throughout Central Florida, actually. Clermont, Orlando, Bellevue, the Villages. We even got one in Tucson, Arizona, if you ever find your way out there. Today's question that you should be asking, that you're not, is, what's this? I don't know if you can see this or not. I'm hoping that gets in the camera frame pretty good. I'll turn it in a couple different angles. Right? This is a bone oscillator. Alright? Now this probably means nothing to you. Alright? If you were wearing a set of hearing aids that you bought in the state of Florida, and you didn't ever see one of these, if this never got put on your head, then somebody, you may have just forgotten, alright, that they didn't do it. Alright? I doubt seriously that somebody would break the law and sell you hearing aids without using the bone vibrator. What this device does, alright, some people, clinicians, right, put it on the forehead. Others will put it behind the mastoid bone and cross it over. What this does is it tests your hearing by bypassing the outer ear and the middle ear, the eardrum and the space behind it. It puts sound through vibration onto the skull, which then is picked up by the auditory nerve without having to pass through the outer and the middle ear. The reason we use this is to rule out issues with the middle ear that would result in a referral to an ear, nose, and throat physician. But again, if you never use one of these, right, how do you know that somebody's hearing loss couldn't be fixed or resolved via medicine or surgery? So in my clinic, it's not an option. You got to use this. You're going to test somebody's hearing the traditional way, right, for the information that you need to fit a hearing aid, right? But you're also going to receive bone testing so that we can determine if there's a need to get you to a surgeon to talk about surgery as opposed to hearing aids. If you're not having one of these done, the whole picture isn't known. The whole truth is not there. Yes, we'd have enough information to sell you hearing aids to help you hear better. But remember, in my office, it's not about selling you hearing aids. It's about helping people hear better that want our help and need our help. And if this tells me that you're better off seeing a surgeon, guess what? You're going to see a surgeon to get that opinion. And if the surgeon says at that point that you don't need help, you're going to come back and see me, and we're going to help you with hearing aids, but we're not going to skip that step. So, when you go to an office to get your hearing tested, right, and you don't see one of these, you need to ask, hey, what about the bone oscillator? Aren't you going to test me for conductive hearing loss? Hope that makes sense. And remember, there's 9 more questions like this one. Questions you should be asking that you're not before you buy hearing aids at my website at fixmyhearing.com. Thanks for visiting with me today.